Okay, so I just went over the different category of expenses for Medicare Part A and B. And the last thing that I had emphasized there is maximum out-of-pocket costs, or the lack of, when it comes to Medicare. Medicare is a great healthcare system for our seniors in the sense that it covers the bulk of our medical costs. And it does it at a relatively low cost as far as a monthly premium is concerned. The only dilemma is that there is no cap on your overall expenses. So if we look at especially Medicare Part B, I had mentioned the co-insurance for that is 20%. Medicare picks up the majority of the costs at 80%, but your costs are 20%. So as you can imagine, if you have something significant happen, then your overall maximum out-of-pocket cost is unlimited. It could keep going. There is no maximum. Your out-of-pocket costs can continue rising depending on what type of treatment you're receiving. So just to go through a quick scenario for you, I'll give you a Medicare Part A and B cost scenario. I have a client that had a scenario where he was in original Medicare, was in an unfortunate car accident, ended up being fine, had some broken bones and concussion. His costs on Part B alone exceeded the $50,000 mark. So with the simple math, 20% of $50,000, Jack had to pay at least $10,000 on his Part B costs. He also had a Part A deductible of around $1,300 and some other costs associated with that as well. So while his scenario was not an extreme scenario that, you know, we've all known somebody that's been in the hospital for maybe days or weeks on end, but it was an interesting scenario in the sense how much he had to pay for that car accident. So I just wanted to go through that with you real quick. Again, it boils down to your Part B co-insurance amount and not having a cap on all of your Medicare Part A and B expenses.